This is shoulder ultrasound. This is the normal anatomical alignment. What the provider is doing, they have the ultrasound probe posterior with the indicator placed laterally. This is the proximal humerus right here, and you can see this kind of curved appearance. And then right here is the scapula. This is a patient who came in with a shoulder dislocation. You can see this looks very different. This is, again, the scapula. This is the glenoid process, and this is the proximal humerus. And you can see this gap, which shouldn't be there, in this anechoic fluid here, which is a hematoma. If you were to do an intra-articular injection, you just aim your needle into this area, and this is the perfect spot to do the anesthetic. You can use 1% lidocaine, about 20 cc's. Another option is to use 10 cc's of a 2% lidocaine. After the anesthetic was placed and the patient felt a little bit improvement in pain, a closed reduction was done, and in real time you can see that the ultrasound illustrates alignment of the proximal humerus with the glenoid of the scapula. This is the scapula right here, this is the humerus, and you can see that they're pretty much next to each other. So take this view here and compare it to what it looked like prior, and I hope you can see the difference on what an anterior shoulder dislocation looks like. Again, the probe is held posteriorly, right? So if you're coming from the back of the shoulder, the scapula is the first thing that you're going to see, because more anteriorly, which is the dislocation, you then see the proximal humerus.